Hello, in this second video on the Nobel Prize in Physiology and Medicine from 1903, we're going to again look at the work of Niels Ryberg Finsen for his contribution on the treatment of diseases, especially lupus vulgaris, with concentration and light radiation, whereby he has opened a new avenue for medical science. Well, due to illness, Mr. Finsen did not give a Nobel Prize lecture, so I looked for an alternative. And I found it in an article written by Dr. Valdemar B., which was a laboratory assistant at the institute founded by Finsen in Copenhagen, which did light therapy. I believe it was his closest collaborator. And the article was written by Dr. B., and it was also read and endorsed by Finsen himself. The editor's intro. Dr. Finsen, this article was written, I believe, around 1905 or something like that. Dr. Finsen had success treating lupus by means of concentrated light, and Dr. B was asked by Dr. Finsen to describe the method and results to the British Medical Journal. Finsen treats patients with different eruptive diseases, especially smallpox, with red light. The chemical rays of light, blue, violet, and ultraviolet, can cause inflammations of the skin. These rays are suspected to aggravate pre-existing inflammations. It is therefore that the diseased skin is protected against these rays. It is possible to diminish the inflammations, prevent suppuration. There should be now in the new way of treatments, these rays are used as curative agents. Part 1. The bacterial property of the chemical rays of light. This property has been demonstrated by Downs and Blunt. It is important to find out whether or not the bacterial property is attached to a single part of light. Blue and violet, for instance, and especially ultra-red light give the best results. We are now talking about lupus vulgaris. Only a few % of the effect of light is due to red, yellow, and green rays, as was found out by B. Thus, for the treatment, violet and ultraviolet are used. The others are uses, the other rays. It is important that the bacteria are killed swiftly. In the first treatment, it took days, weeks, even months. This was due to the experiments, the way the experiments were done. Using plate culture by Vincent resulted in faster results. It took only hours for the rays from the sun or the lamp to kill the bacteria. Dus this was in vitro done, not on patients yet. That was later. Killing bacteria on grown skin would take longer. This is no use for therapeutic treatments. Finsen concentrated the light for effect. Only concentrated blue, violet, and especially ultraviolet rays work fast enough. Bacteria can be killed in seconds. Then part 2, the power of the chemical rays of light to produce an inflammation of the skin. The old name, erythema solare, shows that it was believed that the disease, lupus vulgaris, skin tuberculosis, was caused to intense heating of the skin. Whitmark showed the idea was wrong. Whitmark also showed that it was not the heat that caused the inflammation, nor was it the visible light, it was the ultraviolet. And Finsen confirmed it and discovered that blue and violet also can cause inflammations to a lesser extent. This is of consequences for the treatment of lupus vulgaris and may be of use in the treatment of bacterial skin diseases in general. Then part 3. The power of chemical rays of the light to penetrate the skin. Gardner and Finsen placed small glass tubes with muriate of silver under the skin of dogs and cats. Some animals remained in the dark and others were put into sunlight. After an hour, the murals of the animals in the dark were unchanged, but the murals in the animals in the light had darkened. This proved light penetrates the skin, especially in bloodless tissue. The skin is best made anemic for light its treatment is applied. Thus the skin is best made anemic for light. Treatment is applied. Yeah, these 3 proven facts made an objection against the treatment difficult. Sunlight is used in the summer, electric and lamps otherwise. This must be concentrated, the light must be concentrated, but is cooled not to burn the sun. See figure 1 for the apparatus using sunlight. Well, here it is. Here you see a lens, and it is used to concentrate the light, of course, on the skin. The lenses used were made of blue glass. This blue glass filters away the ultra-red, we now call it, I think, infrared, red and yellow rays that have a large heating effect. Most of the bacteria are killed, killing blue, violet and ultraviolet can pass through. So it also works as a filter. It doesn't only concentrate the light on a specific place of the skin, but also filters out the non-usable light and let pass through the usable light. Figure 2 shows the section of the apparatus used for concentrating the light coming from carbon lamps, for which quartz lenses are used because they allow more than glass to let the ultraviolet rays through. Here we see that apparatus. Yeah. Okay. The rays that leave the device converge. The conversion rays come together about 10 centimeters away from the device. Just before leaving the apparatus, the light passes through distilled water, further reducing the ultraviolet, which has no value, no medicinal value, but heats the skin and burns it in a sense. 4 of such apparatus were concentrated on a ring which is self-fixed on the ceiling. The lamp can be adjusted in several ways depending on the situation. You see the rack. Yeah? Okay. Here you see a part of the apparatus. We will come later, and here we see an outside patient in the sun. Later we will also see the inside version. The light coming from both apparatus is still too warm to be applied to the skin in a safe way. This is done by the apparatus shows as X in figure 3 and in figure 4 in using tubes inlet through water to cool the skin. Here you see that apparatus part and also here. Here it is. This is the part. Yeah. It uses tubes in letting through water to cool the skin. The light passes through the part of the device through a plate and the lens of quartz. In an hour per day, a piece of skin of 1.5 centimeter diameter can be treated. The skin reddens and swells, may develop a bulla, but not necrosis. This kind of treatment works for lupus vulgaris, lupus erythematosus, and alopecia areata, my difficult Latin words. Other skin diseases were not treated in sufficient number to be sure of the value. Then follows in the article a more detailed inquiry into the 3 named here diseases. Here you see the apparatus in action. You can see that 4 or 5 places can be treated at the same time. Here you see the apparatus, another apparatus in sunlight. You see the lens. You just saw that. Okay, first is lupus vulgaris. Around 350 patients have been treated. For most serious cases, the light treatment is combined with pyrogallic acid ointments to allow the light to enter the skin better. More important, it saves time for the patients, but is not necessary for a good result. For the present, only the skin, the hard palate, the front part of the septum nasum tongue, and the mucous membranes of the cheek can be cured so. In all cases, there was a positive result, though it sometimes took time. Even severe cases could be treated with success, often unsuccessfully treated otherwise. Results are promising to improve further because improvements have been made on the used apparatus, now using quartz instead of glass lenses. We point also to examples of patients that were treated this way. See the figures 8 to 7 to 15. Maybe here we have 2 patients before and after treatment. There's a significant difference, as you can see. Continuing with the results derived from the treatment of the 350 patients, principal advantage of the method, the great cosmetic results it yields, the infrequency of relapses and the painlessness of the treatment. No tissue is destroyed. One can treat healthy and disease skin until one is sure all the diseasing germs are destroyed. A treatment is stopped when no distinct nodules of lupus can be seen. When the swelling and redness of the skin is gone, one can check whether the disease is gone or not. The patient remains under observation even when the disease is believed to be gone. If Niels are again seen, a second treatment follows. Often the patient chose to continue the treatment for a while. Recurrence is likely to occur, but treatment is often stopped to make way for new patients. And we deal also with each patient in some length skipped gives me more data on several patients, but I've skipped it here. It would make it too long, but it's interesting reading. Here you see another 2 patients before and after treatment. Then the other 2 diseases, lupus erythematosus. Treatment of this disease is often done with excellent success and resulting in permanent recovery, but the rate of success is lower as compared to the previous disease, lupus vulgaris. In some cases, healing is slow with a tendency to recurrence, but only 28% patients were treated at the moment this article was written. Then the third disease, alopecia areata, only 7% have been treated so far. The trails look promising. Further experiments are needed. If successful, it also supports the theory of the infectious origins of this disease. Well, this was a summary, of course, of the article by the B, which describes the work of Finsen. The full article can be found here. You can type it down or you can watch at the description in the video where it's also added. This ends this video on the 1903 Nobel Prize for Medicine. Thank you for watching. Maybe see you later.